In terms of where...
The number might be small, but I think that's the kind of thing we need to keep in our mind to keep our hopes alive. I think it is very important for us to know that people with this illness have the capacity to reach there. It's a reflection of the support, it's a reflection of the systems of care.
And within that grouping of annual income, 88% of those people were still receiving a pension. So and that would have been a what they call the invalid pension.
Better name for it now, disability support. You've grown in the years.
Do we call it?
Yeah.
Oh.
We just started calling it as a disability support allowance about 24 months ago.
Oh, I am out of date.
That's basically because the government felt that if they label it that way, they might be able to take it off a bit more easily.
And that's also another major problem that I've heard that you have here as well, is that the support system is that good that for people to go out and get a job, they'll be worse off than if they stayed within the welfare system. And so that also is another factor in people not getting full-time employment, because they would lose a lot of the benefits, and the work that they would get wouldn't be as good as that. If we looked at family history, 62% did not have a family history of schizophrenia, and nearly 36% did have some history, and 2.4% were not sure. In this sample, 90% were still visiting health professionals, and 9.5% did not have any contact with health professionals, mental health professionals. In terms of age of onset, and remember we're saying we did this so we could compare our group with those prognostic indicators from the literature, so you would expect them to not to have an early age of onset. Whereas in this sample you can see 52.4% had an onset between the age of 10 and 20. 26.2% had an onset between the age of 21 and 25. 14% in this age range, and only 7% had an onset over the age of 30. Look at the duration of symptom in terms of the development. We'd ask them, you know, do you think that your symptoms develop quickly, or did it develop over a period of time? 52% said that they had a sudden onset, and 45.2% said it developed over a few years, and 2.4% weren't quite sure. In terms of how long they'd had the diagnosis of schizophrenia, 12% had had the diagnosis for 10 to 15 years, 36% for between 16 and 20 years, 45.2% for at least 21 to 30 years, and 7% for more than 30 years. In terms of hospitalisation, 93% had had hospitalisation in the past, whereas 7% had not. In terms of whether they are still taking medication or not, 85.7% were still taking medication, and only 14.3% were not taking any medication at present. So that is really the last part of that research.